Imagine feeling lost in a world that shifts between what's real and what's not. Ever felt like you're hearing voices no one else does, or seeing things that aren't there? Are you curious or concerned? Either way, you're in the right place. Today we will talk about a topic that perhaps all of us have heard about but maybe do not fully understand. That is psychotic disorder. So without any delay, let's get started. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. So let's start with the first point and understand it one by one in detail. So the first question that comes is, what is this psychotic disorder? Psychotic disorders are a type of mental health issue where a person's ability to think and understand is affected. In this condition, an individual cannot differentiate between reality and their thoughts, meaning things that actually don't exist appear real to them. For example, hearing or seeing something that isn't actually there, or false beliefs that they fully trust. This makes it difficult for them to function in daily life, maintain relationships, and understand themselves. It can start at any age, but is most commonly observed in youth or young adulthood. I hope you now have a little idea about what a psychotic disorder is. Now, let's understand psychotic disorders in detail, one by one. Moving forward, let's learn about the different types of psychotic disorders. There are several types of psychotic disorders. Here we will tell you about some important types. So let's begin, starting with schizophrenia. This is a mental disorder in which the person finds it difficult to connect with reality, including hallucinations, such as hearing absent voices, and delusions, false beliefs, such as conspiracies to cause harm or considering oneself special. Next, Schizoaffective Disorder. In this condition, symptoms of schizophrenia are present, along with symptoms of mood disorders such as depression and mania. Next, Brief Psychotic Disorder. This is a short-term condition where you experience psychotic symptoms for a few days to a month, often in response to emotional trauma or stress. Next, Delusional Disorder. In this disorder, you hold certain false beliefs that are far removed from real life, such as persecution, jealousy, or grandiosity. Next, Shared Psychotic Disorder. This is a rare condition where your psychotic symptoms, such as delusions or hallucinations, are transferred to another person who is close or emotionally connected. These were some types. If you feel any point is missing from this, do let us know in the comment box. Now, what are the symptoms or signs? Let's understand this. It's not possible in this video to cover all the symptoms, but we will tell you about some common symptoms that will give you a much better understanding. Let's now look at these common symptoms one by one, starting with hallucinations. In this, you hear, see, or feel things that don't actually exist. For example, someone calling your name when there's no one around, or you see something that isn't there. Next, delusions. Here, you hold certain false beliefs that do not match with real life. For example, believing that someone is following you, someone could harm you, or that you are on a special mission. Next, thought disorder. In this, your ability to think is affected. Your speech can be scattered or unorganized, or you might suddenly change the topic without any clear connection. Next, disorganized behavior. In this, the way you perform daily tasks deteriorates. For example, difficulty in bathing, eating, or doing household chores. Next, negative symptoms. These are symptoms that reduce your normal abilities, such as a decrease in emotions, lack of motivation, or social withdrawal. Next, emotional flatness, where you can't express your emotions or your face remains expressionless. Next, difficulty in concentrating. In this, you find it difficult to focus on any task or remember things. So friends, these were some important symptoms of psychotic disorder. If you know about any other symptoms, write those symptoms in the comment box. You can share your strategies in our comment box. Now we move on to the next point, where we will learn about the causes of psychotic disorders. So, let's see. There are several main causes or factors for psychotic disorders, but it's also important to understand that this is a complex condition and there can be more than one reason. Starting with genetic factors, if someone in the family has had a mental health condition before, it increases your chances of having psychotic disorders. This is due to genetic predisposition. Next, brain chemistry and structure. An imbalance in neurotransmitters in the brain can also cause psychotic disorders. Imbalance of chemicals like dopamine, changes or injury in certain parts of the brain can also be reasons. Next, environment and life events. Some environmental factors like extreme stress, emotional trauma, or drug abuse can also trigger psychotic disorders. Emotional, physical, or sexual abuse during childhood is also one of the risk factors. Next, substance use. The use of substances like alcohol, cannabis, cocaine, or amphetamines can also trigger psychotic symptoms, especially if you already have a genetic predisposition. Next, physical illness or injury. Certain diseases or brain injuries can also develop psychotic symptoms, such as Parkinson's disease, brain tumors, or certain infections. These were some causes that can lead to psychotic disorders. Now we move on to the next point, where we will learn how psychotic disorders can be prevented. Some steps can be taken to prevent psychotic disorders. Let's look at some common steps one by one that can help prevent it. There's no sure way to prevent psychotic disorders, because there can be many causes that vary from person to person. However, there are some steps that can reduce the risk and improve mental health. So, let's start with reduced stress. Life comes with its stressors for everyone, but excessive stress can have a negative impact on mental health. Find ways to reduce stress, such as yoga, meditation, or spending time on hobbies. Next, avoid substance abuse. Stay away from substances like alcohol or drugs as they can trigger mental health conditions. Adopt a healthy lifestyle. Good sleep, a balanced diet, and regular exercise are crucial for mental health. These simple steps can help keep you mentally fit. Next, build a strong support system. Build good relationships with friends and family. Talk to them whenever there are problems in life. Staying away from loneliness has a positive effect on mental health. Next, mental health awareness. Increase your knowledge about mental health and reduce stigma towards it. This will help people talk openly about their problems and seek help in time. So, friends, these were some important points by following which psychotic disorder can be prevented. If you feel there is something missing in these points, do let us know in the comment box and share your strategies in the comment box. Now we move to the next point, where we will learn how the diagnosis or examination of psychotic disorder is conducted. Diagnosing psychotic disorders is a comprehensive process. It cannot be done just by looking at symptoms, as sometimes other health issues also show similar symptoms. Let's start with medical history. First, the doctor takes the complete medical history of the patient, which includes their current condition, previous health issues, and any family history of mental health disorders. Next, psychological evaluation. In this step, a detailed conversation occurs with a psychologist or psychiatrist. It deeply covers the patient's thoughts, feelings, behavior patterns, and experiences. The doctor asks the patient specific questions about their hallucinations, delusions, or other symptoms. Next, diagnostic tests. Sometimes brain imaging tests such as MRI or CT scans are conducted to check for any structural problems in the brain. Blood tests may also be done to rule out infections or hormonal imbalances. Next, assessment scales. Some specific assessment tools or scales are also used, which specifically measure the severity and nature of psychotic symptoms. These tools provide professionals with a better understanding of the symptoms. So, friends, these were some important points that help in the diagnosis of psychotic disorder. Now we proceed to the next important point, where we will learn how psychotic disorder is treated and what methods are used. So let's begin. The treatment of psychotic disorders typically involves medications, therapy, and sometimes a combination of both. It depends on how severe the condition is and what the individual patient needs. Let's start with psychotherapy. Therapy or counseling is also a significant part of the treatment. Cognitive behavioral therapy, CBT, is considered particularly effective. It teaches patients ways to control their thoughts and behaviors, and also how to change negative thoughts into positive ones. Next, social support. Support from family and friends is also very helpful in recovery. Sometimes, family therapy sessions are conducted so that family members understand how they can help their loved one. Next, life skills training. Some programs focus on teaching life skills, such as managing daily activities, social skills, and job skills. These help the patient become more independent in their daily life. Next, hospitalization. Sometimes, if a patient's behavior becomes dangerous to themselves or others, or they are unable to care for themselves properly, short-term hospitalization may be necessary. Here, they receive round-the-clock care and monitoring. Next, rehabilitation programs. These programs are for patients who are recovering and need help reintegrating into society. This can include vocational training, educational assistance, and social skills training. So, friends, these were some important points through which psychotic disorder is treated. If you feel something is missing in these points, do let us know in the comment box and share your strategies in the comment box. Now it's time for conclusion. Psychotic disorders is a type of mental health issue where a person's ability to think and understand is affected, such as hearing or seeing things that aren't there, or holding beliefs that aren't true. However, treatment is possible. With the right medication, therapy, and support, people can manage this condition and live a normal life. This was our video for today, in which we first looked at what is a psychotic disorder, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, and finally, how can it be treated. I hope you liked this video. If you find anything missing in our video regarding points or tips, please do share your thoughts with us, and don't forget to share your strategies with us. Also, share it with your friends, family, or colleagues to help them. We'll see you in the next video with treatments for a new illness. Until then, thank you very much. Please don't forget to like, comment, and share. Thank you.